Does anybody need a copy of the press release we sent out earlier? Or,
Usually no. Okay.
all right, we sent a press release out with the advisory. Did you not get it?
No, we probably did.
Okay. Hey, Steve.
Hi, how are you?
Good.
Oh, there was something I asked you about. Okay.
Good afternoon, everyone. I need a little space here. Oops, here. All right, well, good afternoon, everybody. Thank you for being here. It's been quite the interesting day. For those of you that were here this morning, where the sun always rises. We were outside at the patio earlier this morning. And I'm here to start with probably the most important part, and we'll wait till the doors stop slamming there. My name is Mark Sullivan. I'm CEO of Catholic Health. I'm pleased to assure you that throughout the day, we've been working tirelessly to make sure our patients, our number one concern at Catholic Health, are cared for here at Mercy Hospital and at all the sites impacted by the CWA strike. It's important to note that right now we are caring for about 200 patients at the hospital. And I have a stat sheet that I'll provide to you regularly so you kind of know what we're working with at the hospital. Typically, we have about 322 patients on the inpatient side, and right now we have 200. The leadership team of Catholic Health and the hospital have been in every room, on every floor, working closely with the staff to ensure the patients are comfortable, they're safe, and they understand what we're dealing with, but most importantly, their care is there for them. We also know in the emergency room, we typically see, on Tuesday we saw 102 people, and today so far we've seen 52 people that we cared for right to my right here in the emergency room. You know, we said this earlier, that we have an excellent team of nursing and healthcare professionals who are temporarily here with us from around the country. About 5:30 in the morning, I got to greet some of them. They come from all over the country for one main reason. And that's the commitment we started at Catholic Health 170 years ago. And that's to ensure, no matter what the crisis, no matter what the situation, snowstorm, labor strike, flood, anything we have, that we provide the best care we can in all circumstances. So we're grateful for the workers that are here to help us temporarily during this crisis. This is a period where the CWA has taken associates away from the bedside to picket outside, as you've heard when you came in. It's important to note that we're working very closely with the New York State Department of Health. They have been through Mercy Hospital. They are working closely with us to ensure a smooth transition here and the other outpatient sites that Mercy operates. I want to thank those temporary workers as well. I also want to applaud the contingency workforce management team that came together. As you know, we were handed a 10-day strike notice. And when that strike notice is handed to us, that means in 10 days, the CWA could strike. When we received that notice, the wheels had to start in motion. Because as I started this conversation, the number one priority of Catholic Health are the patients. And with the uncertainty of the strike notice with no end date on it, we acted on an abundance of caution to ensure our patients would be safe. We also have a planning team that's constantly monitoring everything from supplies to patient transport to interactions with our patients, and we're focusing on that as well. You know, it's a trying time for any leader today in America and around the world, but here at Mercy Hospital, it is a trying time. There is not a leader on the Catholic Health Management team that is not committed to ensuring our associates feel appreciated, our associates are recognized, our patients are cared for. So I'd be remiss if I didn't thank the president of Mercy Hospital, Eddie Bradco, Sherry McDonald, the chief nursing officer, Tim Gabriel, the VP of Patient Care Services, and Christina Tobin, the VP of Operations here at Mercy, who have been working tirelessly around the clock to ensure the patients that want to receive care here at Mercy receive that care. It was kind of moving this morning about 5:15 when I arrived up in the staging area, and there was over 100 volunteers from Catholic Health, both lay people like myself and medical professionals that came in to help support their colleagues here. You know, Catholic Health is what we call a ministry, and we come together in times of crisis, we come together in times of celebration, and I was really proud of the team that came together. I want to move on to talk to you a little bit about some questions that came up. At the press conference this morning, I wanted to make sure I got to the floor, so I didn't have time to answer questions, but some questions came to our PR department. And one of them were, what was the sticking point? Why couldn't you get to a deal? We sent you a press release that outlined all the things that were listed in our most current proposal to the union, but I want to walk you through that again. I committed to that on Wednesday. I did it yesterday in interviews with many of your stations, and I want to remind you of what we've put on the table. We asked the union, what are the key issues? And you can hear it chanting outside: staffing, wages, and benefits. Well, let me be clear. Last night, actually it was this morning, I'm sorry, it's been a couple days, this morning, we answered that call after weeks of conversation and mutual understanding of what exactly that meant. For example, we have put a proposal forward that is a $32 million wage package out of $250 million wages. What does that mean? That means on average, there are workers that are getting anywhere from 2.5% to 32% pay increases. Not just at Mercy, but we went a step forward. For all the bargaining positions represented by CWA, we did a cross-check with the union to ensure, from EVS to technical workers to nursing to any technologists that are part of this contract, they were recognized, and they are now, in the proposal we submitted, at a competitive market wage in this community. The second was staffing. When we're done with this interview, I encourage all of you to Google healthcare staffing shortage. And if Catholic Health is the only entity in this country that comes up, come back here and ask me some questions. This is a national crisis. I've been here 30 years, and there hasn't been 1 year when there hasn't been a staffing challenge. However, we must note that this is very different. We're in the middle of a pandemic. We're in the middle of exhausted workforce that are out there picketing. We're in the middle of staffing shortages where people are making decisions to leave nursing and other healthcare professions. For example, September 2nd, the American Nursing Association sent a letter to Health and Human Services stating you must do something at a national level related to nursing shortages. And just this week, Governor Hochul announced a disaster emergency related to healthcare shortages. I can't, as CEO of Catholic Health, wave a magic wand and create staffing tomorrow. So what did we do? We sat down with the union for multiple hours, and we talked to them of what does staffing mean to you. We brought in our Director of Talent Acquisition and Retention, who sat at the bargaining table to listen to union leadership, to understand what do you need to help us recruit. They explained a lot of things, we learned a lot, and they learned a lot. We have national recruiters around the country now looking to recruit for people to come to Buffalo. But you know, that's not enough because it doesn't solve the staffing crisis today. But what commitment could I make? We committed to staffing at 10% above the average daily census, which is unheard of in healthcare. But we went a step forward. We committed to hiring between 150 and 230 additional associates into the bargaining unit with a direct path through a clinical retention committee that the union and management would participate in. But that wasn't enough. So in the wee hours of the morning, the only health system I'm aware of in the state, and probably in the country, put $20 million into staffing. What that meant is Catholic Health will strive to hit those staffing numbers, which we are in agreement with, which are called staffing grids. You're hearing that out there. But we made a commitment. If we're not at those grids on this journey to staffing, we will pay a premium to those individuals that step up and work, and we'll also pay a premium going forward in certain areas until we can recruit to those areas. We put that in writing. It was a proposal that was all done earlier this morning. Health insurance. You may have heard that when you were pulling in here. The question was, we're taking away their health insurance. Early this morning, we went right back to what they had in their original contract. We pulled any changes in health insurance we wanted. The health insurance benefits that they are offered now are not the same as they are throughout the rest of New York healthcare, but we recognize that was important to them. And they believe, the CWA, that by doing that, we could recruit more. So we respect their opinion, and we did that. So let me be clear. Wages, we addressed that. We were close. We're close. We know that. They recognize that. For all workers, between a 2% and a 32% increase. Staffing, I've already mentioned to you, we're committed to that. We always have been. There is a staffing crisis. Also note that many nurses, there's another study that came out that said 39% of nurses between the ages of 20 and 35 have had a decrease in their satisfaction working in nursing. It's unfortunate because this is, as I said earlier, my family's hospital. The nurses that work here, the caregivers that work here, the caregivers that are out there on the street are the soul of this hospital. The last comment I made, what will it take for us to have a deal? Why did I ask that? Multiple reasons. Number one, patients come first. Number two, which I'll talk about with the pandemic, you don't even need me to answer this. Go back and research what you reported on how Catholic Health took care of its associates during the pandemic. Go back and find quotes from the CWA that commended us for what we did to protect the associates. We need to do something for them. September 1st, I received a letter dated September 1st from 22 politicians in this area that said, if there was a labor strike, it would be a disaster for the community, it would be a disaster for the patients, it would be a disaster for the union, it would be a disaster for Catholic Health. 8 days later, the strike vote was authorized. We are trying to prevent a disaster and keeping the patients first. So I'm here to tell you what we've done as of earlier this morning, and we were there. When we asked at the table, and again, my team was at the table, why are you going on strike? We have presented proposals. The comment was made, it's about principle and respect. And we asked them to pull the 10-day strike notice because we're so close. Let's take 2 more days, come back, we have 3 more hours, and the union left. Another question. I'm trying to make sure I get the questions from earlier this morning because I promised I would read these. When do you think you return to negotiations? I started this interview by saying our patients are our #1 priority. We are in the middle of working with the Department of Health. We're in the middle of stabilizing the staff here at this facility and the other Mercy Hospital facilities. And we want to be back at the table, but our #1 priority that was thrusted upon us is to ensure we have safe patient care at Mercy, and that's a priority of everyone at Catholic Health today. And we want to, as I said this morning, get back to the negotiations, but our #1 priority right now are our patients. We're disappointed, and I pause because we're disappointed. I was confident yesterday that we were answering the questions of the union. I was confident early this morning by putting things in writing, unheard of that any CEO would do, and a good faith effort to address those items I mentioned to you before. We want to have a deal. We respect the CWA, we respect their leadership. We want to take the high road and have a deal. I'm here today to share these facts. Everything I said to you today is factual, it's in our press release, and I wanted to make sure that you knew that. How do you take care of your associates at Catholic Health? How could you let this happen? Well, you know, I shared with you what we offered, but what you don't know, which is not reported, but I thought would be important to let you know. Every worker you see out there, Catholic Health has no obligation to provide any benefits when they're on strike. We decided that everyone that is on strike will be able to maintain their health coverage for themselves and their families. We did that because they're our associates too. They are the soul of Catholic Health. They're the soul of Mercy Hospital. So we did that because we wanted to do that. I need to also thank the community. When the strike was announced, I think it was sometime between 3 in the morning and 6 in the morning, the community outpouring about us working hard to support our clinicians at the bedside. We saw it in 2020. How could this happen? Stay at the table, work through this. We know Catholic Health is a good organization. We know you lead the region in quality. How could this happen? Those are comments that come in through text messages, phone calls, and emails. But once in a while, during a difficult situation, something shines through even greater than that. The door behind you, a young man walked in earlier this morning. We don't know who he is. And he came up to a security guard and said, I want to know how they can help. I can't believe they're doing this. We can't believe it either. However, we are 100% committed to ending this strike, but it's up to the CWA to recognize where we were earlier this morning and how we answered their questions around those areas that I just mentioned. If you see any press clips from them or you see any press releases from them, I believe the 3 areas I mentioned are the core of everything. But I have to show some respect to the members that are out there picketing because they are tired. They are overworked. They've been through a pandemic. They're still dealing with a pandemic. I respect their energy. They're our associates too. I respect their energy, their desire to have a fair contract, their desire to be able to take a breath. This is a national crisis, and I'm standing here today as the CEO of Catholic Health to tell you I am 100% committed to addressing the crisis. It's a journey. It can't be a one-day event that's fixed. And I wanted to make sure you heard that today. So I have to go back to where I was going through the different floors, but I know that the press statement said that I would take a few questions. So I will take a couple questions if you like. Yes. Scott, how are you?
Steve Brown from Channel.
I know.
2 points on the negotiations. I did not hear about any concessions from CWA. Are you telling us that there weren't? And secondly, is there a scheduled negotiation session for Monday?
I'm not. There is no scheduled session for Monday. Where we were, so we submitted our proposal. I mentioned to you that it was actually economic proposal. Today is Friday, so I think that was Wednesday. They committed to giving us back their economic proposal. You got to remember, it's a $250 million contract, so it's not one piece of paper. They committed to giving that to us at 3 p.m. yesterday afternoon. We got a piece of paper handwritten at 8 p.m. We were, at that time, I think between $80 and $100 million off. So we moved, as I said, to $31 million plus the $20 million for staffing, and we were awaiting a final proposal. However, in fairness to the CWA, we were in agreement with the pay scales. We were in agreement with these adjustments for the workers that were below $15 to get them up to where they are, for the workers that have been here a long time to give them a little one-time bump. So we worked through all of those things. So I'm more shocked than you are. We were trying to seek to understand what would happen, and they said it was based on principle and respect. So that's where we were. I deployed my whole leadership team, our CFO, our leader of operations to the table for the last 3 days to make sure they could explain what we were trying to accomplish, to make sure we were listening to what needed to be done. And I'm saddened, disappointed, but I know that we heard what they were saying, and I know we put forth a package. And if you read the presser we sent out, it speaks for itself.
How much is Catholic Health paying to bring in these replacement employees?
Millions of dollars.
Do you have a specific number?
I don't right now because it's a fluid situation. It's the first, we're less than 24 hours into a strike. So that's the number I have now.
Why would that money have?
I just signed today. Let me explain how that works. Right now, there's a national staffing crisis. If I say it again, you're not going to write it down again because I've said it many times. There are multiple strikes throughout the country. There's multiple labor shortages. I met a person today from Oakland, Kansas City, Oklahoma, Florida, Texas, and California. They're here for as long as they want to be here, but they also need to go to other cities. So in January of 2020, we signed with this company because our bargain was supposed to be last year. There's a communication now that says that the union decided to do a one-year extension. That is not true. I called the union and said, given how stressed we are, given there's a second wave of the pandemic, why would we go into labor negotiations when we don't know what's going to happen? They agreed, we agreed on an MOU, and we pushed it off a year. There was an installment made in 2020 for them to join us. There was an installment made before the strike notice. You have to do an installment just to keep them on retainer, given all the activity in the country. Once we're handed a strike notice, once that was handed to me, I had no other option than to sign an invoice for millions of dollars because I had 10 days to get enough staff in this building to protect our patients. As it went on, there's another installment at 5 days, and there's another installment today because they're on strike. And then we go into payments by the week. Of course, my goal is not to do that, not because of the financial reasons, but primarily because I want the workers back in the building. But my obligation as CEO is to put the patients first, and that's why we did that.
But how long can you sustain that?
What's my choice? What would you do? If you're responsible for the lives in this hospital, what would you do?
I'm just saying, I took a look at a previous release earlier this month, showed cash on hand has been shrinking pretty consistently.
Yes.
You had, I think, the last report's 107 days worth of cash reserves on hand. I'm assuming that that number is small. So I'm just trying to figure out from your standpoint, how long you could sustain this particular strike before perhaps giving in what it is that they're looking for.
Last night I gave in to what it is they're looking for. And let me be clear, there's a report out there by Kaufman Hall that came out 2 weeks ago. $53 billion is the estimated losses for all health systems around the country, give or take a few billion. I don't have a choice. We were founded 170 years ago with no money, with a daughter going door to door raising $5,000 and opening a hospital in a school. We have an obligation to this community. I don't want this strike to go on. How long will I let this go on before I give in? I gave in last night. I asked, what else is there to do? And they said, there is nothing you can do. We're going to go on strike out of pride and respect. Yes, that wasn't the right word, what I said before. Principle and respect. So let me put it in perspective. For COVID, we spent hundreds of millions of dollars. We're the first health system in the last to implement hazard pay. $20 million went to the workers that are walking out there. We were the only health system in the region that had sufficient PPE because we scour the nation for it. We're the only health system in the state that was asked by Health and Human Services to put together a one-page paper of how we dealt with COVID with the St. Joseph Hospital and a post-acute nursing home. And again, we're the only health system in the nation that decided to spend millions of dollars and convert a hospital into the only COVID-only hospital in the country, and one step further, to do the same for the nursing home. Final comment on integrity, if we want to go back to COVID. We were the first health system in the nation to test every single nursing home resident and associate. That led to an awareness that you're living through today. And we did that out of integrity. Not just tested, but reported it to all of you once we knew the results. So I don't want this to continue. I didn't want it to continue last night, but we are here to serve the community. This isn't a standoff. We have given them what they asked us for. We believe that. We were there waiting to make sure that was it, and they left the table. Yes, ma'am.
Mark, there's a strike happening also at the nursing home down the street, Mercy Ambulatory
Yes.
Center in Orchard Park, and here at Mercy Hospital. There's patients inside all of those facilities. What are you hearing from patients and their families who are possibly worried about care that they're receiving inside?
Yes, so each of the leaders of those facilities, so OLV Nursing Home is a 5-star nursing home. It's one of the highest rated nursing homes in the state. The administrator there has rounded with the patients, the same within this building. Of course, everyone is scared because we have people in this building that are on palliative care with hours left, and all they hear is what the noise is outside. So patients are concerned, families are concerned, we're concerned, but we round with the patients and we try and help them the best we can. That's why we constricted some of the services earlier in the week to make sure we could really focus on that. And the reason it's those 3 sites is because they're part of the CWA contract. And in the MOU signed in 2016, the only facility that could strike is Mercy, and those 3 facilities are that. So we have people, I can tell you right now, just give me 30 seconds, going to the MAC Center today. We had 37 patients as of noon today that went to the MAC to receive care. Again,
How many temporary workers are there?
hundreds. I don't know the number off the top of my head because they keep coming in. One of the challenges we have is, you know, I try not to do this, but the vans that we're trying to bring the workers in are being blocked. So we have patients that need to have care and they're being blocked by the picketers. We think we've addressed that, working closely with security, but we'll have hundreds throughout. And we did that based on that contingency planning, and then we did that based on constricting the services to make sure that we weren't overcommitting to the community given the crisis we're in right now.
Do you know how many patients are on end-of-life care?
Not at the top of my head. We have a total of 200 in the house.
You said you usually have 322?
I can tell you, I want to make sure, I told you this is going to be a factual interview, so let me look here, okay? Typically, we have, well, actually on Tuesday, I should say, of the 28th, we had 322 patients. We worked closely with care management, the primary care physicians, the families, to get down to about a 200 number. And with today, we had 14 that were admitted. So maybe that number will go.
Typically, you would say you have over 300 or?
322 on Tuesday.
But on average, you would say it's usually over 300?
Yes, it all depends on pandemic, activity in the community, bills, games, snowstorms, all those things, so.
Sorry, but someone just said that you guys proposed to decrease dental coverage and increase premiums and high deductible.
No, we, last night in those hours, we went in and said that we will be current contract. It's in your press release. Here, I'll show it to you. Because I know people are watching and making sure that I'm telling the truth, of course. Let's look right here.
High deductible with an option.
Here you go. Hybrid, high deductible, plan with an option. Contribution rates, there's no change. Dental, no changes from the current contract. And that's what I offered early in the morning.
You gave us this?
Yes, this was a media release that came out before I got here. That's why I'm asking questions, because I wasn't going to until they said in the back here, Mark will answer the question.
Gotcha.
So I'm not going to let you down. I'll take one more question. Is there anything that I didn't cover? Any facts you wanted to check with me? I'd be happy to answer.
CWA workers told me this morning that there have been times where they were going to meet at the table and Catholic health representatives were hours late. Is that true? And if so, what was the holdup?
That is not a fact. Let me explain how this works. I've been in bargaining for Catholic Health for 10 years. I sat in a hotel room waiting 9 hours for a proposal, and you're not waiting like someone's holding out. They're sitting in their caucus room talking about what the offer was that came back. What does this mean to the organization? You're talking to nursing leadership, medical leadership, financial people. We have been at the table. There's 3 rooms. There's the room the CWA meets in. There's actually 2 rooms now I think about it. The room that CWA works in, and the room they're called caucus rooms that Catholic Health works in. We have been there every day. We've said we'll stay as late as we want. We're used to being there till 5 in the morning. There was never a time. They could have been waiting, but they were waiting like we were waiting for a proposal. We were not doing any slow no's. We were either working on a caucus proposal. The difference between now and then is the current leadership of CWA Local was not part of the bargaining committee before this year. The old committee would know that it's 3 in the morning. When we ratified, or when we had a tentative agreement in 2016, it was 5:15 in the morning. And we did an MOU and we were done. So we're used to that. So both leaders of the union and Catholic Health got together. They'll say, we're going to give you a proposal tomorrow, or here is this proposal for a $250 million contract. This is what we want in staffing. So we take it in our caucus room, we spend hours working on it. And some things are in packages, so economic packages. Some things are in staffing packages. Some things are called common table items. You have to remember one thing that's very different from us to other systems in the community. We're negotiating 6 contracts. They're all different contracts. So we worked with the union, and we're really proud of this, and so are they, to try and align those contracts. So we had equitable wages, common terms where we could, and that was a monumental lift. So there is not a day when we were not at the table. I'm telling you right now, there wasn't. They could have been waiting, but it's no different than any side rating in a negotiation. When you hand a proposal during a negotiation, that is a proposal that you're giving to the other party. It is a document, it's a legal document of a proposal. It must be right. If you're having a conversation about a proposal, that's different. So when you're talking contracts as big as we're talking, it takes time to do that. I wanted this over months ago. So did the union. We just didn't understand each other until probably the last month. And the only reason we are rushing is because we're giving a 10-day strike notice, which we never received in 2016. This is the first time we've ever received one. At 3:15 that same night in 2016, we were threatened with a strike notice. And 2 hours later, we got the deal. So that's kind of what that works. So
Mark, are we going to suggest another date to bargain, or are we waiting for the union to come to you?
I have to, we will answer that. We're ready. They have what they asked for within relative terms, because this was at 2 in the morning, right? So they need to look at that and see that. We're committed to bargaining. We don't want this to continue. My goal today is to focus on the patients. You got to look at this building. When you have over 200 patients in here and the staff walks out at 6 in the morning, we got to take care of these people. So that's the priority. Right, wrong, or indifferent. You can write and report what you want, but I'm in this business because of that. And I take pride in the workers that are out there. As I said, they're the soul of Mercy Hospital, but the patients come first. The patients come first. That's why I signed the contract you asked me about. That's why we're spending millions on this. That's why we spent millions on COVID last year. And that's why we're protecting the patients. That's our number. That's why we exist. Without the patients, we don't have an existence, and that's how we were founded 170 years ago, to meet a need. Yeah, this isn't a standoff. I told you what we gave them. You have the paper. You'll read what they've written, that there's no staffing plan, there's no competitive wages, there's no health benefits. This is the paper. Read it, and everything that they are saying out there are things that we tried to address earlier this morning. I'll take one more question, because they're really good questions. Anybody have anything they want to ask at all? Anything that you want me to clarify on any of the facts? Okay, I'm going to leave you with a closing comment then. The CWA is an incredible organization that supports its members. They're committed to healthcare. They are in the business of healthcare. The people that are represented, that they represent, and the people that work for us are in healthcare for a reason, because they care. I commend the CWA for their vigor and what they're trying to accomplish. But we're there. The Catholic Health Team has the same vigor and commitment to patient care. We're not in this business for any other reason than to care for patients. So we have mutually aligned goals, mutually aligned understanding to some extent, maybe different beliefs on how to get there. But right now, my understanding is we have addressed their concerns. I cannot bus in, although you're seeing it today, 300 nurses to Mercy Hospital to start working here for the next 10 years. We have to have a plan to get there in a macro environment where our governor declares a state of emergency. We know the federal government's looking at new things to do with nursing. We own what we have here today, but the staffing crisis is a long-term solution. My final comment is, as CEO of Catholic Health, I have an obligation that's about balancing fair and equitable wages and benefits for the associates with the future viability of Catholic Health. I must make sure we're here for generations to come. There's a balance there. I think we're there. We'll continue to fight the fiscal crisis, but we're there, and we're committed to that, and we're committed to work with the union to get a deal done so the soul of Mercy Hospital can return. Thanks for being with me today.
Thank you, Mark.
I have copies of the press release if anyone